Shall we start? So that we don't get pressed by in terms of time. So we go with Kasiet first, please.
I'm not sure whether I'm showing this on I'm presenting.
You are.
Do you see my presentation?
But yeah, just press the presentation mode.
Okay, thank you. Hello, everybody. I'm very glad to be here because I'm Academy's alumna myself. And now I'm working at Central Asian Barometer, and I'm going to present the data we gathered this summer. We conducted let me not rush and tell you a little bit about Central Asia Barometer. Not everybody knows about this fine institution, which conducts very important research in the region. Basically, Central Asia Barometer conducts different types of applied social sciences research. First of all, we have a long-run ongoing project from 2017. It's a survey project we conducted in all 5 Central Asian countries, and we use different methods to conduct those surveys. In the beginning, we used PAPI method. It is paper-based survey. Then we switched to tablet-assisted survey, and this year, due to the pandemic, we used CATI. CATI is computer-assisted telephone interviewing. So people were just at their homes, from their comfort of their home. They just called the people which we selected for them to call, like our interviewers. We do our research according to international standards for surveys. They were first moved forward by SMR and VAPOR. Let me briefly tell you about this project more. This project is for sample size is around 1,000 to 2,000 people. But this year in the summer, we had sample size of 1,467 people in Kyrgyzstan, and in other countries, we had 1,500 people. But this year we didn't cover Turkmenistan due to technical reasons, and we also were able to ask very limited number of questions in Tajikistan. In comparison with last waves, we were able to do more in that country last years, but this year, due to the many reasons in that country, maybe things are tightening up. That's why we weren't able to do much there. But we have interesting data on Kazakhstan, Uzbekistan, and Kyrgyzstan. If you are interested, you can go through by this presentation. I will send it soon. There is a comprehensive information and methodology we used this year. Yes, and for example, in order to get the representative sample, we used simple random sampling of mobile phone numbers. And for example, in order to get a representative sample of Kazakhstan, we needed to dial 65,000 people in order to get this representative sample. What does it mean? How do we weight the data? We weight it according to the age, urban-rural divide. Yes, and of course, gender. Yes, the questionnaire includes questions on economics, on internal politics, on international politics. It also has questions on current events, maybe if there is upcoming parliamentary election in the country, we ask questions about political parties. If we just had an election, a presidential election in one country, we ask questions on the results of the presidential election. Also, the questionnaire has extensive part on the demographic section. It has questions on ethnicities, on religious practices, as well as education and like occupation and ACC. So, but today I'm going to present the data only on the public health section of this of this survey. And let me start. In the beginning, I will talk mostly about Kazakhstan, Uzbekistan, and Kyrgyzstan. And in the last slide, I will talk about Tajikistan. So from this survey data, we had very interesting insights. For example, we have a question which states like, how confident are you that your country has the necessary resources to handle coronavirus? And the 8% of people in Kyrgyzstan answered that they are confident that their state has the necessary resources. 12% in Kazakhstan said that they have the resources, and surprisingly, maybe not, 66% in Uzbekistan said that they have the necessary resources. Kyrgyzstan is the country with the highest percentage of people which are confident that their country doesn't have resources, and the country which is concerned about the crisis more than their neighbors. 76% in Kyrgyzstan are concerned, were concerned in June, July, and 70% in Kazakhstan and 45% in Uzbekistan. Also, we see there is a negative significant relationship between the confidence of the population that the state has the necessary resources to fight the coronavirus and concerns about the situation in the country. So the less the population is confident in government opportunities, the higher their level of anxiety. So maybe that is the reason why of the situation in Kyrgyzstan. Okay, let's move on. There is also, we have a question in our questionnaire, we have been asking it from 2017 on how do you think, is your country moving in the right direction? And we see this year when we added questions on coronavirus, we see that there is a direct relationship with between assessing whether things are going in the right direction in the state in general and the availability of resources in the state to fight the coronavirus. The population who believes that the state is moving in the right direction also believes that in the availability of the resources. Okay. There was also a link between ambulance satisfaction, the access to medical care and the level of concern about the coronavirus. People who assessed the level of their access to medical care showed that they were very concerned about this situation, logically. And then we also see there is a gender divide in this COVID-19 pandemic. We see from our data that women are much more worried about the coronavirus situation than men, and they are more afraid of getting infected themselves and that their relatives will get infected. For example, you see here that 71% of women are very concerned about the coronavirus, and only 57% of men are concerned. And also there is a 44% of women are concerned that their family member will get infected, and only 31% of men are very concerned about the situation. Also, we see that the older the respondent, the more worried he is about the situation with the coronavirus, and the more he is afraid of contracting it himself, or that his family members will get sick. So, for example, among 18-29-year-olds, 56% were very worried, very concerned, and among 60-plus-year-olds, 78% of people are worried. Okay, let's move on. Let's talk about the measures, the government measures in response to the pandemic. So we see here among the Central Asian countries, Kyrgyzstan, Kazakhstan, and Uzbekistan, we see that Uzbekistan population is more supportive of the government actions in response to coronavirus. Kazakhstan's population is the most critical. For example, only 59% of people support banning gatherings, while 71% in Kyrgyzstan and Uzbekistan support the same. And also 38% of people in Kazakhstan support closing schools, while in Kyrgyzstan and Uzbekistan, 59 and 57% of population. Okay. And also there is an interesting and maybe funny thing. We found that women are more supportive of restrictions than men, with the exception of closing schools, maybe because the burden of taking care of children are shifted to women. We also see that the population over 60 years old is more supportive of social distancing, and they agree to stay home across all these countries, but they show less support to also for closing schools. Maybe because older population is usually asked to take care of the children as well. Okay. There is also a relationship between a comparative assessment of the economic situation in the country and the attitude towards restrictive measures. People who believe that the situation has improved from the last year, the economic situation in the country improved from the last year, that they are more supportive of the restrictive actions. But people who answered that the economic situation in the country didn't improve from the last year, they show less support for the restrictive measures. And also, we see there is a educational level divide about the COVID-19 pandemic. For example, we see that the higher the education, the more people are concerned about the situation with the coronavirus. For example, we see that 79% of people with higher education are concerned about this crisis, while only 55% of people with incomplete school education are concerned with the virus. Also, we also in our questionnaire have been asking a question on the family's financial situation over the past months. And we see there is a relationship with this question, with the question on concern about the coronavirus. So, for example, the higher the respondent assesses the financial situation of his family, the less he is concerned about the coronavirus. So here we also see the divide between the poor and rich, maybe somehow, because people who are more confident in their financial situation are less anxious about the crisis. Also, we have asked a question on how do you think which of the following countries is the best able to help your country to handle the coronavirus? And we see that the number of people who think that Russia is the one who is best able to help increases with age. So, for example, among 60 plus year-olds, 72% think that Russia is the best one to help, and there's less support for other countries. But among young people, for example, among 18 and 29-year-olds, 19% of people think that China is the best able to help. Okay. Here we also, from 2017, we asked a question on media usage. And we also found interesting insights in the relationship between which media the respondent uses and how he is concerned about the country, about the coronavirus. So we see that the biggest amount of anxiety and concern about the coronavirus is among the users of Instagram and WhatsApp messengers. And there is a lowest percentage of worried among those who don't use social media at all. So maybe this is related to the amount of the fake news that are mostly shared with social media. And also we see there is a divide between the messengers. For example, 71% of people using WhatsApp are concerned about the coronavirus, and only 47% of Telegram users are concerned about it. And the last slide is about the question we were able to ask in Tajikistan. It was the only question we were able to ask, and it is related to the measures to stop the coronavirus, personal hygiene. So, for example, 95% in Tajikistan said that they increased the frequency of using hand sanitizer. 92% said that they started to wash their hands more frequently, and 89 people said that they started to limit their social interaction more. And also, interestingly, we see that the protective gloves are the most, the least favorable measure to stop the coronavirus. And I'm done with this. If you have any questions on the methodology or on our future survey projects, please feel to contact us directly via these emails. Soon on our website centralasiabarometer.org is now outdated. It's still functional, but it's outdated. Soon we will have another new website, and we will release all of our data there, and everyone interested will be able to download it and use it. So with this, I will...
Thank you. Thank you very much, Kasiet. Again, just to remind, Kasiet Ysmanova is Communications Manager and Researcher at Central Asia Barometer. We complain a lot in Central Asia about lack of regular time series available, regularly done and serious survey data. And hopefully Central Asia Barometer will be filling that gap or contribute to filling that gap. Of course, increasingly we see different organizations, different institutions engaging in it. Now, looking at the timetable, I'm happy to report that we have, well, some minutes to spare. Kasiet, are you willing to take a few questions if you
yes, of course,
if we open that? I mean, maybe we can give 2-3 minutes, 2-3 questions.
Okay, I will happy to answer.
All right. Is anyone interested in maybe clarifying anything, asking something? So in chat, we have one question. Let me just read it. You mentioned that you also asked questions about elections. According to your survey, would you relate the COVID-19 pandemic with the protest before and after the election in Kyrgyzstan? If yes, in what way did the pandemic influence the voters? Very interesting question.
Yes, that's an interesting question, but we asked this year, we asked a question about elections. We weren't able to ask this year in our autumn wave. We have conducted our autumn wave, but the results are not ready. We didn't answer the election related questions because it was too sensitive at the time. It was in October, but I think that COVID-19 pandemic didn't Yes, it actually, I think that it has an impact on the protests, but we weren't able to do it in the right timing. We conducted it in June, July, and I think that the population wasn't able to the crisis in our healthcare system happened during that time, and we did it at, around those time. And I think that the people weren't able to come up with explanations why did it happen. But we asked a question about the how do they support Kubatbek Boronov, and now I don't have exact numbers, but the number of people who support him was very low at that time. Yes. And also there was a question about the corruption, and there was an increase in the number of people who think that the corruption has gotten worse during the last year, yes, within that spring wave.
Interesting. Yeah, and of course, I think the available data in your hands would be before the elections, right? So your fall wave,
yes,
you said we still need to get to learn. And another question comes from Niva. Interested to hear your thoughts on to what extent do young people's perception of China's help to Central Asia correlate to actual amount of Chinese aid given to Central Asia? Of course, understanding. So your thoughts rather than you may not have the actual amounts of Chinese data within the survey data. And also we want to hear your thoughts on why you think young people think China contribute more to helping.
Okay. For the first part of the question, we don't have a question on the Chinese aid. Actually, in our survey, we have questions on Chinese investment projects in Central Asian countries, but we don't have questions on Chinese aid, like direct aid. So that's why we cannot relate these two questions. I think that why the younger population is more a favorable perception of China to help with the coronavirus crisis is because it correlates actually with the question on media. For example, the older population consumes lots of Russian content, Russian TV channels, but younger people are not that suspected to that influence of Russian media. Also, what was the second part?
Niva's question, second part. I think that you got it. I think that's
yes,
said.
But I cannot give a full answer, and I don't know why younger people think China would contribute to help.
Yeah, so it's an interesting puzzle that your survey results give that encourage further digging now.
Yes,
and
I would just add, we have a question on investment projects of China, but if Niva would be interested, I can share with her some. There are also interesting data on it in all Central Asian countries. Yes.
Well, great. I think this will be tying very well with Niva's own presentation in a short period. Now, one more question I think we can take, a more methodological question. Hello, thank you for the presentation. This is Ayday Isataeva. Could you please specify, is it a repeated cross-sectional data or time series one? Do you choose a new random sample for each time points or what?
Okay. How to say it? It is time series. It started in 2017 and it continues to this day. But the random sampling is different. Yes. But the difference is not big, and also the questionnaire sometimes includes new questions, but the core part is the same. if I was able to answer.
About your sample, I think, of course, a new random sample every time, of course.
Yes.
You don't go back to the same people each time.
No, we don't. We don't.
Of course, yeah.
Mm-hmm.
Really not really possible, I think. And my own just curiosity, I think this only applies to Kyrgyzstan, this International Republican Institute surveys, the IRI surveys that have been done, I don't know, 7 or 8 times already, I think.
Mm-hmm.
Have you compared your data with them? Because I see many questions actually echo between these two surveys. Do your survey returns sort of repeat each other or
Okay.
agree with each other?
Okay, we haven't conducted such analysis, we didn't compare them, but I just looked through and I think they're very similar to each other. Like they complement each other in many ways.
Yeah.
But
All
we
right.
didn't do a comparative analysis.
Yeah. Okay, right, good. Well, thank you very much, Kasiet, and wishing good luck to Central Asia Barometer. As you build up steam and do more waves, I suppose many new questions will arise methodologically, to which you will be finding better and better solutions over time, because survey research is an ever-improving thing for everybody who engages in it. Now, I think we can proceed. Now, with applause, we can proceed to our regular panel presentations then. And we have, well, like I already said, Niva Yao, our research fellow at the OSCE Academy, and her presentation is going to be on China's medical diplomacy in Uzbekistan. That will be very interesting, especially for those of us in Kyrgyzstan. This is going to be some interesting news.
Thank you, Emil. And
we'll give you about 15 minutes, Niva.
Okay. Thank you, Emil. Good that we're ahead of schedule, so I guess I don't have to rush or anything.
No,
yeah. The data was super interesting. I noticed that across Central Asia, in your data, all the young people, thought China was, were doing more to help Central Asia during COVID. And I think you're right to highlight, media has a role, and it's something that I want to, I guess, dive into, looking at, media diplomacy, but medical diplomacy. But medical diplomacy today, my focus will be on Chinese traditional medicine. And this is a particular medical diplomacy that is staged by China. So as we all know, COVID-19 started, the first month, or the end of 2019 in China itself, and in January 2020, a lot when the cases were really growing to be very evident in Wuhan and other parts of China around the world, there were a lot of countries and governments that already started giving aid to China, and that includes US, Japan, Germany, all these countries, and when this spreads to the rest of the world, of course, China reciprocated and started giving aid also to other countries as well. And so around the world, apart from giving, protection kind of gear in terms of masks and hand sanitizers, air concentrator, things like that. Apart from that, China also, gave a special gift, which is traditional Chinese medicine. Not a lot of Central Asians have had their experience with Chinese traditional medicine, but being from Hong Kong, I grew up with such medicine. It's basically a mix of herbs, sometimes 5 types, most of the times over 20 types of different herbs, flowers that you find in some, either special greenhouse or, sometimes in the mountains. It's a special mixture where you boil together and then you extract the liquid, and then, these days they make it into a pill or some sort of squishy medicine where you kind of eat and digest. So it's not your traditional medicine that you make in the lab where you isolate, certain chemicals and certain particles and things. It's not very, it's not the most scientific medicine out there. However, this is, something that Chinese traditional medicine will never become, precisely because of how complex the different types of medical herbs that have to, work together. And this is something that science, because of the, scientific methods that, in the West have, this Chinese traditional medicine will never be scientific, will never be, on the same level as Western medicine, so to speak. And so when COVID started, the Chinese president already came out domestically in China saying that we should use the traditional Chinese medicine. It helps. We already showed that in hospital it works. And when COVID started spreading all over the world, again, the Chinese president came out and said that everywhere in the world should use this Chinese traditional medicine. And there's been a lot of serious efforts to revive the status of this once esteemed ancient remedies, like, during the Silk Road era. And in Central Asia, the scale of this, medical diplomacy with special promotion of traditional Chinese medicine has been the largest in Uzbekistan. And which is why today I just want to talk about China's medical diplomacy with this special mention of Chinese traditional medicine in Uzbekistan. There were some here in Kyrgyzstan and in Kazakhstan as well, but nowhere on the scale like they did in Uzbekistan. And with this experience and with this, I want to highlight what this means for China-Uzbekistan relations, and also, going forward, what are the kind of issues that are related to the evidence that I will highlight now regarding medical diplomacy. So, like I said, after Chinese president called on the world to use Chinese traditional medicine to, as treatment for COVID, Chinese diplomats around the world, including in Uzbekistan, also were making a lot of public statements with local medias telling the public, telling Uzbek officials that traditional Chinese medicine has had a good effect in the prevention and also the treatment of, the coronavirus infection. And, the Chinese ambassador went on, detailing some of these medicine as well on TV. And for many Uzbeks, I believe is a very new type of medicine that they were, never exposed to. And COVID-19 has served as, the best occasion for China to really sell and promote Chinese traditional medicine, because there's no vaccine. Let's try it, right? It's herbs, people were, feeling quite optimistic. Why not, right? But interestingly, so before the Chinese diplomats in Uzbekistan started promoting these medicine in public, the Chinese business community in Uzbekistan were already mobilizing donations everywhere in Uzbekistan, including large batches of these traditional Chinese medicine. In late March, there were 4,500 bags that were transferred from China to Uzbekistan, and that's a total of 350 servings for 350 people, as a trial. And then again in early April, there was another batch from the Chinese Enterprise Chamber of Commerce that transferred to the Uzbek business community. And then when the first batch of Chinese doctors came to Uzbekistan in the middle of April, the part of the team were traditional Chinese medical specialists that toured around Uzbekistan, teaching Uzbek doctors how to use this medicine. And along with these doctors, they also brought a lot of these different boxes of traditional Chinese medicine worth over almost $200,000. And for China, for a lot of people in the world who are not very familiar with this medicine, see it as a herbal alternative to Western medicine. But for China, traditional Chinese medicine is more than an alternative medical solution. A lot of mainland Chinese nationalists, including some officials, have gone on to politicize, and this is only in the past 2-3 years. They politicize and they parallel traditional Chinese medicine as the effective and sometimes even better Asian option than Western medicine, just like Western liberal democracies. So they say, well, you know, Western medicine don't always cure, you know, cancer, but here is a Chinese alternative, an Asian option, a herbal option, you know, especially, you know, targeting those who, you know, failed to be cured by Western medicine, you know, targeting countries that, you know, have been failed by Western liberal democracies. So they link, you know, Chinese authoritarianism and Chinese traditional medicine as, you know, same kind of, you know, alternatives for the world. So when the first team of the Chinese doctors returned to China from Uzbekistan, they brought good news. They said that Uzbek doctors were extremely eager to introduce Chinese traditional medicine to their patients and to use, you know, in COVID and beyond. And also they brought with them a special letter from the Uzbek president, a thank you letter to the Chinese president. And when, you know, good news spread, leaders in Beijing thought that this really was a great step forward in soft power. Well, obviously, with this amount of special promotion and success of you know, Chinese traditional medicine promotion, you know, what I can see from this is that there's obviously an extremely, you know, high level mutual willingness to build stronger relations, and this is quite evident in the past few years. And this COVID-19 has, you know, shown that to be, you know, a continuous trend as well. And why I say this is because, you know, when the Chinese doctors were touring Uzbekistan, the regional Uzbek heads of governments around the region, they accompanied these team of 20-something doctors everywhere, catering all their needs, from food to using military planes to transport these doctors and, you know, equipment between the regions. And the funny thing was the Chinese doctors were very, you know, quite picky about what they ate. So they didn't want to eat, you know, that much Uzbek food. So the Chinese embassy actually had to, you know, had a chef that would follow these doctors and cater their meals, which, you know, the Uzbeks were okay with. So there's a, you know, really high level willingness to work together and accommodate each other. And apart from that, on the ground, you know, apart from these official Uzbek heads of, you know, governments regionally or at the high level, Uzbek elites were also targeted as China's first point of contact. For example, we have two examples. So one example is the Uzbek president's son-in-law was part of an effort to distribute China's traditional Chinese medicine donation to Uzbekistan. There were investigation reports by Uzbek media showing that you know, there's a aroused a lot of suspicion that this son-in-law was giving out the medicine initially for free, but then were found to sell them later for $40, 20 times higher than the standard price in China. And you know, China working with Central Asian elites or working with only elites around the world is not something that is uncommon. But what this case has shown is a continuous mechanism of cooperation. Is that, you know, China is only working, you know, first and foremost with, you know, Uzbek governments and Uzbek elites. And, you know, this preference is already facing a lot of backlash, you know, as, you know, corruption continue worsen amongst these local elites. And, you know, we see this in Kyrgyzstan, we see this in Kazakhstan, and we see this in Uzbekistan as well. So the moment that these Uzbek elites were found, you know, having links, you know, to helping China distribute these medicine or even equipment, you know, people were already aroused a lot of suspicion of corruption and, you know, China risk, you know, being associated to that. Another case is the Zaman Foundation, which is set up by the First Lady of Uzbekistan, also aroused a lot of suspicion from local media of corruption after receiving a lot of oxygen concentrators from China. And so with this case of China's medical diplomacy in Uzbekistan with this special, you know, promotion of traditional Chinese medicine, of course, we see that there's a high willingness to work together, but we also see the issues that are, you know, prolonging to be very problematic, which is, you know, this preference to work with local elites. Fact is, China has to wake up to the various constraints that come with, this over-reliance on local elites, not just in Uzbekistan, but elsewhere as well, which, ultimately hurt Chinese interests in the long run. And there are two reasons for that. So firstly, the strong ties with local elites don't translate into better governance. So when local elites, like in Uzbekistan, they direct Chinese investments to profitable sectors, there's a lot of poor governance that create an uncertain business environment. In Uzbekistan, there's a lot of talk about inviting foreign investors, but there's very little on the ground planning to make sure that these businesses actually make money. In certain cases, in one region, there are 2 or 3 car factories that are all competing against each other, one Chinese, one German, one Russian, for example. And this is a poor governance that, if China were to keep working just over-reliance on local elites without actually looking over what are the proposals and what are the plans, then this does not translate into better governance that will ultimately hurt China's interest in China's business in the long run. Uzbekistan's poor governance during COVID is also quite evident, whereas Kazakhstan was able to actually increase their export to China. Everywhere else in Central Asia was not able to, even try to export more to China. Kazakhstan has had a 20% increase of export to China compared to this time last year. And it's all because of not just because of the train lines are able to transfer cargo without a human, which now you can't cross the border with humans and drivers and things like that. But not just because of that, but also because of Kazakhstan's governance quickly shifted to make sure that these cargoes can pass the train lines efficiently. So there were a lot of bureaucracy that were quickly overcome for these cargoes that were meant to be transporting by trucks to now be transporting by trains. So these paperwork, supposedly can be, done quite quickly, weren't able to be done in Uzbekistan, which could have also transported cargoes via train into Kazakhstan and then into China. But Uzbekistan were not able to respond to that quickly, purely because of poor governance capacity. And secondly, China's over-reliance on local elites do not buy trust in Uzbekistan. Paying bribes or being very lenient about working with local elites doesn't mean that local elites love China or want to work with China or want to protect Chinese businesses. For example, there's a case of a hydropower stations that were in the talks for about 5 years between the Uzbek government and the Asian Development Bank. And the Asian Development Bank found a Chinese company that was willing to come to Uzbekistan, build for an extremely cheap amount of money, teach Uzbek engineers and operate for 2 years and then transfer it to the Uzbek government. But the Uzbek government refused this deal. Reading in between the lines of the report, you can sense that the Uzbek government didn't trust the Chinese company to not just operate, but also to teach the Uzbek engineers. I mean, they say that, they don't trust the Uzbek capacity to run this, hydropower station, and it's too messy to have Chinese engineers all the time. So, but in the end, it was a lie, because just 2 months ago, the Uzbek government took the exact same project to the EBRD, and now they've given it to a French company to construct this hydropower station after, making excuses about, how this project is, not viable and all that stuff. Ultimately, it was because the Uzbek government didn't trust the Chinese company. Now, all of this means that, after COVID, obviously with China's economy, having signs to show that it's quickly recovering, we can expect that next year, when hopefully we have vaccines and everything goes back to normal, we can expect that the Chinese government will initiate a strong wave of investment in strategic locations, including Central Asia. And it is expected that some of these investments will land in Uzbekistan as well, together with Kazakhstan, of course, as always. However, with how China-Uzbekistan relations are developing under COVID, and with all these COVID medical diplomacy related cases and corruption suspicions, and all of the things that these events highlight is that China's role of method of cooperation in Uzbekistan is not changing. It is doing the exact same thing in Uzbekistan the way they did in Kazakhstan, the way they did in Kyrgyzstan. And now with this expected wave of investment going to Uzbekistan next year or the year after, if the strategy is unchanged, what we will see in Uzbekistan is likely, the things that we see today in Kyrgyzstan with projects being cancelled because there's local discontent, with protests on the street because of Kazakh government's decision to rent land to foreigners. We will expect to see a stronger wave of pushback in Uzbekistan by the locals if this method of engagement remain unchanged and the Uzbek government remained absolutely unprofessional regarding with how they deal with investments.
Oh, thank you very much. Very interesting things here. I was wondering what I was beginning to believe that herbal medicinal diplomacy might work better than democratization and civil society diplomacy in places like Uzbekistan, but apparently even that can have its own drawbacks. At this point, I just wanted to remind, or actually say for the first time, that questions to the panelists we will collect and pose them at the end of this panel session after the discussants' remarks. And until then, either the participants, the audience here, can keep their questions and then ask then through audio, or post their questions in the chat box on the side. Yeah, if you type your question already as we move, we'll just need to keep track and not lose the thread of those questions. We already have a couple of remarks to Niva's presentations, but just to proceed with the orderly plan for the panel, let's move to the next presentation before we take a 5-minute break. And the next presentation is by Dr. Shairbek Jurayev, postdoctoral research fellow, the OSCE Academy in Bishkek. And the presentation is, what has COVID-19 revealed about international relations of Central Asia? Please, Shair.
Okay. Good afternoon, everyone. I hope you can all hear me well. I don't see many of you, so many names on my screen, and just 3 faces, or not 2 faces only. But I hope you're all staying well and in good health. I think by the 3rd day of the conference, you know all a lot about the coronavirus and the COVID. So several kind of themes may already be getting repeated. Nevertheless, I think it's a timely thing to remind ourselves that just exactly a year ago, I think in November, late November or December, when the first reports of this strange virus emerged in China, and 1 year, so we have 1.3 million people died within the year, and probably more will die in the coming months until the vaccine reaches every single person on the planet. So it's a lot. And although the coronavirus is primarily a medical issue attacking a human body, not institutions, not the buildings and so on, apparently we see that because of the scale of the problem, because it kills the person, it's so contagious, it has become a harsh test to everything from public healthcare systems to national economies to international institutions. And probably COVID now is deciding the fate of political leaders. Some are winning, Some are losing elections because of the way how they dealt with the coronavirus problem. As for us, the researchers, so those people who tend to observe the world, the coronavirus, the COVID-19 became a central independent variable. So we have now the COVID impact and apply to everything, every area, to see what was the damage made by the coronavirus in our area of interest. So at some point in the summer, I proposed, even in the spring, the international relations of Central Asia as just to see what has been the impact. And back then, I think the picture was a bit different. I had other talking points in May or June. Now, probably a little bit different. Anyway, the key question that I would like to discuss today is quite simple and straightforward. What has been the impact of the COVID-19 on Central Asia's international relations? Before addressing that, just two caveats on how we can address questions like this, the COVID impact. And I think even the conference title is about the impact of COVID on Central Asia or in Central Asia. First, what sort of answer we want to look, and I think there are three options here. Two are extremes. One extreme is that because of the coronavirus, the life will never be the same again. And we've heard about this probably starting from January or February of 2020, and we hear it from everywhere. Indeed, lots of things appear to change, but that's one extreme. And the skeptics move to another extreme, saying that, okay, nothing is really changing, particularly within debates about IR theories. You can find arguments that, okay, the nature of international relations, the nature of IR international system will not change. And the COVID-19 does not compare to events like the Cold War, the end of the Cold War, the Soviet collapse, or the 9/11, so-called the critical juncture events, so Big Bang events, which led to lots of change in the way how IR operates. So COVID is not going to bring that kind of change. I will not go into those two extremes and kind of start judging whether or not COVID is impactful or not. I think we can leave it to next year to argue on that. So the middle ground that I would like to take is, what are the processes, what are the trends and patterns in international relations that the COVID-19, the pandemic, has exposed or revealed to us, accelerated possibly, or slowed down? So basically this is a kind of bottom-up approach just to see, trying to take stock really of what has been the COVID impact on trends that have already been dominating within IR in Central Asia. The second caveat is that, of course, the topic is about Central Asia, but the COVID is a global problem. It's not a Central Asian problem. And Central Asia does not exist in a vacuum. In discussing, I have basically three topics that I would like to cover here. In all three, I would like to first attend the kind of global or international level before coming to Central Asia, because the COVID impact has been already a topic of massive conferences, special issues in the journals. So first, we attend the wider, broader level of the questions, and the questions stem from generic IR issues, not something specific to Central Asia. But of course, I think all big questions of IR will have relevance to any part of the world, including Central Asia. So I think we will find that relevant. So the three questions or three themes that I would like to discuss when we have COVID on the one side and Central Asia or IR on the other side. The first is the international cooperation. How has the coronavirus global pandemic affected the degree, the nature, the scope of international cooperation in the world and in Central Asia? just like the coronavirus, the novel coronavirus affects the human bodies, if we have pre-existing health conditions, we are told that the damage will be worse. So it matters for virus whether we already have diabetes or the heart problems, obesity, and so on. So apparently, I think in international relations, it's the same. The COVID impact will most likely be seen in areas on themes that have already been emerging to us as the pre-existing health conditions in international system. So within international cooperation, the pre-COVID situation was that of an increasing tension between, for the sake of simplicity, let's group them as isolationism and globalism. In the 90s, when I was a student, it was basically globalization was the biggest topic of all student papers in the late 90s, yeah? Those McWorld versus Jihad, Coca-Cola, McDonald's. So the world then was seen as increasingly borderless world where the nation states are just disappearing, transnational corporations emerging, and basically it's kind of global village vision. But then we have what, 2016, there was a big period and lots of issues, events in between. But 3 years ago or 4 years ago, in 2016, we have like symbolic events. In June 2016, we have British people voting to exit the European Union. So the Brexit happens. In several months, Donald Trump wins the elections. He loses the elections by popular vote, but he wins. So he did a good job by those standards. And both events were symbolically kind of attacks or even reflections of the crisis of the globalism. And they signified the beginning of the inward-looking tendencies within the Western countries. For Trump, America first was the slogan. For Americans, that was a compelling topic, but for the world, it meant America is actually not the first, but America is going to disappear. America is returning home, and we will be seeing less of America and not more of America. The British exit, similarly, if the European Union was the symbol of globalization, symbol of cooperation, then British people said no to that kind of cooperation. So now COVID comes. And I think the answer is probably quite clear, self-evident, how COVID has affected. COVID made sure that people stayed at home, not only leaving country and traveling around the world, but they couldn't even leave their homes. But the borders were shut down. So if trade and travel were the symbols of the international cooperation, both of them were hit very badly. And you all know those slides comparing 2019 to 2020 in terms of, for example, flight, air traffic, drastic difference of trade, international trade, and so on. So we had a very bad year in that sense. So at the global level, we see that the world is going to, I think I'll cut at some point for my third point. But so on this part, we see that the isolationism is getting a boost and the cooperation is getting hard times. In Central Asia, however, I think things are a bit reverse. The pre-existing condition in Central Asia was that regional cooperation was a pain in Central Asia for many years. But again, 2016, this magic year happens, and in Central Asia, that's about the death of Islam Karimov, the symbol or probably the biggest figure that was ensuring non-cooperation in Central Asia. And the new president of Uzbekistan, Shavkat Mirziyoyev, has become not an obstacle, but what we say, locomotive for, at least at the rhetorical level, for cooperation, for openness, for intra-Central Asian relations, and so on. So the COVID came at a time when the cooperation was on the rise. And I think although the COVID impacted the cooperation here in a sense that the third, I think several meetings of the president of Central Asia was postponed due to the pandemic. In August, I think we were scheduled We have them all in Bishkek. It's now postponed. And then the Bishkek events happened, so postponed again. Now it's already in safe place of Turkmenistan. I think the event will take place. But despite the problems, I think in Central Asia, we can see that the political leaders managed to retain a very positive political rhetoric. We don't have Donald Trump's and Bolsonaro, and so that kind of inward-looking nationalist populist leaders who would be critical, fundamentally critical of international cooperation, of supranational bodies, and so on. So the rhetoric is here. Moreover, we have Kazakhstan and Uzbekistan very proactively helping Kyrgyzstan and Tajikistan. And here I would make another point. So in Central Asia, one of the biggest changes that COVID brought, I think, was that together with the symbols of cooperation, we have very explicit symbol of disparity or discrepancy within Central Asia. There was no secret that Kyrgyzstan and Tajikistan were the poorest, the weakest, whatever, the smallest countries of the region. But still, there was a notion that this is a club of post-Soviet countries, fellow post-Soviets. Now, if you look at the news, Uzbekistan is providing grain to Kyrgyzstan. Uzbekistan will build a mobile hospital in Kyrgyzstan. Same thing happening in Tajikistan. Kazakhstan is also helping. I think the COVID basically formalized this distinction. And if the world, or if Central Asia and the relations will never be the same again, probably it will most likely be about the attitude between the rich and poor in Central Asia. I think I ate up pretty much my time, but I'll make those that they are the 2 points faster. The second point was about regional, the power balance. The COVID-19, how it affected the power distribution in the world. And this is a favorite topic for IR theorists, particularly realists. So pre-COVID situation was that China is on the rise. The rise of China, the rise of Trump on the west, China on the east. So basically, we were all discussing the power transition, whether China will take over through war, whether it will be a case of peaceful transition. But it apparently was quite clear that the United States and the West are losing their position. I think the COVID has solidified that trend. China emerged less damaged economically, medically, health-wise, probably at least, and maybe partially to herbal magics of the Chinese plants. Nevertheless, the economically, we have Chinese, the trends are much better, and it's already recovering much better than the rest of the world. But in Kyrgyzstan or in Central Asia, I think the situation is different. We were ahead of the world in terms of China having more dominant position. In Central Asia, compared to the world, I think the United States has left the field well some time ago. So China has been established very well. However, I think the COVID brought something kind of rude awakening to Kyrgyzstan in particular. And that was if China was doing this charm offensive throughout the 30 years, being a kind, generous, benign neighbor, I think now we have less of a charm and more of an offensive emerging. And that's at least observable to the ones in Bishkek, in Kyrgyzstan, when you see your country leaders multiple times asking publicly China to offer the debt relief, to postpone the repayment of the debt, and you have complete silence from China. That is, I think, rude awakening. No more China is that benign neighbor. It's a very tough capitalist who will not be like Paris Club or the Western kind people who would be restructuring every 5 years. And we grew up to that. We were familiar with that process. Now, I think we are surprised that restructuring can be so difficult. And second, I think the rude awakening is also about the remittances, that Tajikistan and Kyrgyzstan suddenly realized how the doomsday scenario can be so quick, can come so quick, so realistic that China will require that payment. Your remittances can drop overnight to hundreds of millions of dollars. So I think that would be one of the things that COVID reminded us and will probably make things worse. I will skip the last point so that maybe we'll have some time in the questions and answers. And anyway, the last point was not the central point. The only thing that I wanted to do is share the screen and see my PowerPoint, which was linked to my third point. So it was about the role of state in IR and the role of people. And since there's a short break right now, I would just like to remind that after my talk, we were scheduled to go to this place most likely. If you all study at the OEC Academy, you know the Dolce Vita, a very fine place with nice coffee and nice pizza. And usually conferences would go there. So Zoom is fine. However, I think thanks to COVID, we're all restricted, and I think you'll have nice time in your kitchen, whatever, for 5 minutes. So I'm done.
Yes.
Thanks.
Thank you. Thank you. I was thinking, Shair, that you were gonna zoom in to one corner of the building where I think some herbal plant or some office has been located, if I'm not mistaken. But anyway, so the next paper, the last paper in this panel, the impact of COVID-19 pandemic on the EU Central Asia cooperation. And with the paper is Ana Maria Angelescu, PhD candidate at the National University of Political Science and Public Administration in Bucharest, Romania. And Ana Maria was here with us as a visiting student as well last year. So very good to see her on the panel. Time is yours, Ana.
Thank you, Professor. Thank you for giving me the floor, and thank you to the OEC Academy for having me. I hope everybody can see my presentation. So my paper is about the impact of COVID pandemic on the EU Central Asia cooperation. My PhD topic is related to this EU Central Asia cooperation, and of course, as my previous speakers already said, the COVID pandemic is a global phenomena which impacted everything, including the EU Central Asia cooperation. And we have a nice context, let's say, for this cooperation. Last year, the EU launched a new strategy for the cooperation with Central Asia. New opportunities for a stronger partnership. It's the second regional strategy after the 2007 one. It's a more focused strategy, a better written one, let's say, because it was drafted after a year-long process of consultation between Central Asian partners at all levels and the EU. This was seen in a quite active diplomacy, political engagement, economic engagement, and technical assistance, let's say even technical partnership between the EU, the member states, and the Central Asian countries following the launch of this strategy. And I singled out the January 2020 conference, Green Central Asia, which was organized by Germany, as the biggest highlight of the bi-regional cooperation following the launch of the strategy, which gave us lots of enthusiasm and showed the potential of this cooperation, which was kind of crashed after the COVID-19 started, because indeed we have lots of online meetings, and even in this week we had a ministerial level dialogue between EU and Central Asia. But at the same time, we all know that direct contacts cannot be replaced by online contacts, and real work is somehow hindered by this only online cooperation. And the context of this new strategy is also related to the EU negotiations for the new multi-annual financial framework, and a new strategic focus on all EU diplomatic actions on climate change. And everything is now related to green recovery in the context of the pandemic and green growth. We saw in the previous talks in this panel that the impact of COVID-19 in Central Asia was significant. I singled out here some sectors where there was previous cooperation between the EU and Central Asia, and where Central Asian countries were hit very hard as the European ones: the healthcare systems, the education systems. We had the problems with personal protective equipment. There were talks about the corruption in the distribution of aid, the limited capacity of hospitals to accommodate all the cases. We had many news of people dying on the doorsteps of the hospitals because they couldn't be diagnosed, they couldn't be tested, or they couldn't be admitted. We had public distrust in the state's capacity to manage the pandemic, both in terms of the healthcare systems and in terms of education. Although people didn't really want the schools to close, they weren't sure that the state was able to implement those measures to ensure the proper distancing. Also, with the school closures, the internet became very valuable, and we could see that not all teachers were properly trained for the schools to have IT skills to properly teach and to use the proper methods to engage the students. And even the students, the pupils, actually, they didn't have access to internet, and in some areas we read news about pupils that didn't have access to electricity, so they to properly access education. Of course, we had in Kyrgyzstan, there was a school through the television broadcasting, but that's also something, this is a temporary measure, and the pupils didn't have access to an individualized interaction with the teachers. It was very difficult for the households, and also this links with the bigger economic impact of COVID-19. And there are many forecasts that show that the economic impact is severe in Central Asia because of the lower remittances, the reduced exports, the higher impact on the small and medium enterprises. And the World Bank even forecast is a contraction of 1.7%, but there are other economic institutions that forecast even bigger contractions of the economics. So this will lead even to a greater external debt, and in this case, Kyrgyzstan is the most affected, and we saw that the Kyrgyzstan and the other countries as well are trying to negotiate with China to release some of the debt pressure, which is not really happening. So coming to EU Central Asia cooperation in times of COVID, we have two areas where this is going on. We have the existing needs, which were there before the COVID. The strategy highlights three priorities: building resilience, prosperity, and regional cooperation. And despite the COVID, there were still some expert talks and political dialogues on the pressing needs that existed before. So we had online trainings and experts meetings on agricultural support for farmers, not only the ones affected by COVID-19, but also in terms of properly managing the crops, and agricultural support also for policymakers. We have many talks about green development, green energy, and energy efficiency. And through BOMKA, we had many border management trainings. And we had with Kazakhstan, Kyrgyzstan, and Uzbekistan political dialogue on at bilateral level on economic and political issues. The new challenges were identified because of the COVID-19, were identified by EU delegations, and the EU delegations on the ground were very active on assessing and providing assistance. We noticed that we had the delivery of personal protective equipment through BOMKA project, but also directly to the health workers and to the civil societies organizations. And I want to notice the fact that to highlight the fact that the EU delegations worked both with the governments, but also with the civil society in identifying the real sectors, the real groups of persons in need of this assistance. And for example, in Tajikistan, they went directly to the civil society organizations and had higher input on the list of the hospitals that received personal protective equipment, of course, with the approval from the government. But the EU delegation was more proactive there in this regards. We had sharing of experiences through an EU risk mitigation center about how the EU doctors are having these medical protocols for treating COVID, how are they, what's the definition of the case, and very medical specific things. And in terms of money, we have a regional program which was dispatched through Team Europe, 134 million euros for regional programs. And we have bilateral assistance, 112 million for Uzbekistan, 36 million for Uzbekistan, and for Kyrgyzstan, 36 million in aid, and an additional 22 euros in loans and guarantees for loans. So the EU is trying to position itself as a political actor also, besides the very active donor stance which it had before. Of course, the pandemic is kind of hindering this political cooperation, because now we have urgent needs. We have the needs of the medical systems, the needs of the educational systems as well. So it's more time, it's less time for talks and more time for clear action. But the EU also dispatched a regional program for Central Asia, designed in 3 stages, each one dealing with the one of the more or less pressing needs. So on the first stage is for the emergency needs, and then we have the medium and long-term effects of the COVID-19. And we are still waiting to see on the public news how the EU and Central Asian countries envision this, the use of this money. We also are on the last stages of the negotiations for the multi-financial framework. Hopefully it will be adopted as it stands at 1.84 billion euros. And we have, because of the strategic redesign of the foreign policy of the EU, we have a redesign also of the financial instruments, and we have this NDC, which is a new financial instrument for allocating development aid, including for Central Asia. And what struck me here was the fact that in this geographical framing of NDC is that Central Asia is allocated, let's say, to the Asian continent, which is also in line with the Asian perspective of the Eurasia connectivity strategy. Usually Central Asia, and before 2016, mostly Central Asia was included in the so-called Eastern neighborhood, which had a more post-Soviet approach. So now we see this inclusion in Central Asia in the Asian perspective, maybe as a bridge between EU and China, and the idea of how to counterbalance the Belt and Road Initiative of China. But there is more to explore here, so it's for future research. After studying these documents of the EU cooperation with Central Asia in times of COVID, I noticed there is a donors coordination. The EU is working with especially UN agencies, but at the same time, we have less strategic coordination between donors. So the idea is that everybody is acting towards the same goal, to help the healthcare systems, mainly in Central Asia, to better deal with the COVID effects. So in this way, for example, a pool of resources, everybody giving the money and putting them together and working on a mechanism, a framework mechanism for accounting for the use of money, for ensuring transparency, it would be of use for the EU. There's also a need for the EU to better define the priorities. We have a more focused approach, as I said, of the strategy, but at the same time, we have still many priorities. And maybe because of the pandemic, the EU would have to reduce the scale of the aid and work on more focused areas. And I singled out some areas that are that may prevent future tensions. So it's education, water management, and border security, where the EU already proved that it's working well and has some results. And the green recovery should be maintained as a transversal objective. It should be maintained in all these approaches. At the same time, the EU shouldn't give up the regional approach. We saw that there is, especially after 2016, there is this Uzbek-driven regional cooperation, and we noticed it during the pandemic too. And of course, there are alternatives too. We have 5+1 dialogues with US, with China recently, and even with Russia. But at the same time, the EU has a unique advantage of being indeed a unitary actor. And of course, it's too much to ask for the EU to be, for Central Asia to be a mirror region for the EU. But at the same time, the more limited cooperation in areas of common interest, like it all started back in Europe 70 years ago, would help the Central Asian countries to overcome the effects of the pandemic. And after this pandemic, maybe we will have more regional cooperation, and the realization that regional cooperation can help the economic growth of the entire region, not only the specific countries. And in this regional approach, the EU should also give more agency to the member states, because it's their resources and their input and on how they approached this regional integration is very much needed. And I think the EU can maintain its position as a unique actor in the region, because usually we have other states with their own interests. So the EU is usually seen as a fair partner without hidden agenda. Everything is laid out in all these strategies. Thank you very much for your attention.
Thank you. Thank you, Anna Maria, very much. It was a very comprehensive overview and complete with good advice to Brussels. Now, I think as per our program, we move on to Svetlana, our panel discussant. Svetlana Zardanova, Associate Member of the Central Asia Institute of Strategic Studies. And of course, for a long time, Svetlana was also housed in this building where I am today at the OSCE Academy. So it's good to see you, Svetlana, and please, you have also now another 15 or so minutes to comment on the 3 papers.
Good afternoon, everyone. And I would like to start with thanking Niva, Anna Maria, Sherbek, and Kasiet for their contribution to our 3-day discussion on COVID-related developments in Central Asia. And I just saw that we still put Central Asia as post-Soviet in our program. It's an interesting thing. It was a great pleasure reading your papers and listening to you today. Also, I'm a little humbled to be here to provide feedback to your inspiring works. Giving advice is a challenge, I think, here, because you 3 know better what you write about than myself, but this was not the last reasoning for me to apply for this exact panel, just to learn more about the research beyond my immediate area of research interest and expertise. So expect no critique, but rather some discussion points for me. So articles in this panel, I think, focus on the various mechanisms and strategies used by different players in the region to address the pandemic and maybe even benefit from the pandemic in the long run, if we look more on China, and on the larger effects of the COVID on regional and international relations. So I will go one by one with my brief comments and some questions to each speaker. And I will start with Niva's paper on China's medical diplomacy in Uzbekistan, which I enjoyed reading very much. I think Niva did a great job presenting her idea in very well-structured, concise manner. And it really adds to a broader discussion on the phenomenon on aid diplomacy, which we were observing from the very onset of the pandemic in the region, going on between Central Asian states and from international actors. So Niva highlights how China saw yet another window of opportunity to use its soft power and boost its image in the region. Because also it's absolutely true that China is the biggest single investor in the region and a strategic partner to each of the CA states. In the reality, it is more complex than that. So because many researchers and maybe if you follow the recent Oxford Society report, point that there is a rising trend of China-related protests. And public opinions polls reveal that China is viewed with greater suspicion. So the piece shows how the public could be won back by China. If we compare this to the very onset of the pandemic, where China was internationally attacked for being the source of the virus itself. So it also adds an interesting aspect of traditional medicine to it, which is unusual, I think. And while you point that corruption in Uzbekistan, as well as troubled image of Uzbek elites, could be one reason why China could not achieve with this exact aid what it aimed for, I think maybe there is more to it. For instance, in her paper, Anna Maria mentions that EU delegations did a very good job monitoring and controlling how aid was distributed, which China maybe failed to do and rather gave it to elites to distribute and control what was going on with the donations from the Chinese government and also big donors. So maybe China could adopt this approach and take a bigger stance in how it controls the distribution in the country. You also might, I think, miss that the general public suspicion to what is Chinese. Like I came across several reports, mainly from Kyrgyzstan, that there are a growing number of anti-vaxxers across the region and Kyrgyzstan, of course. And the main hesitation about the vaccine comes, has to deal with the country of origin of the vaccine. And China, along with India and Russia sometimes, are in the list of vaccines that get under suspicion by local population. So that might be the thing, because I think one of your mentioned articles said that instructions attached to the medicine were not translated into Uzbek or any other language. They were all coming in Chinese. And also, so people usually tend to be suspicious of what they don't understand or consider alien. So this, I mean, you're right that at the highest level, two countries express the willingness for closer cooperation and further development of bilateral relations. However, regulations in place, for instance, the local regulations in Uzbekistan add to the, they are sometimes contradictory and conflicting, and they hinder this development. Like the thing that you mentioned, that Kazakhstan was quite faster to adapt to changing situation, and they kind of switched from transporting the cargo from trucks to trains, which Uzbekistan could not do fast enough. So this could be addressed. I think the local population opinion towards what is Chinese and what is coming from China, and I think this there is an emerging competition between the actual vaccines coming from Germany, China, and Russia, and they soon will be taken to Central Asia. And it's interesting how the local public will react to that. So there's some questions. You mentioned that Uzbekistan was quite the only country where China put the emphasis on promoting the traditional medicine during the pandemic. This is very interesting. And why do you think this is the case? And why not any other states of Central Asia, maybe except for Turkmenistan, which denounces all the cases? So do you think also that China could win some of the image back from the moment when the pandemic hit the region and China was perceived as and accused as a country of origin of the virus? I specifically liked your point on broadening opportunities for local use, because I think that education and scholarships, they could really solve the issue of governance and trust, as you mentioned. And I think we already see that there is a growing number of education centers opening up across the region that offer Chinese language courses. And I think like in 10-15 years, Russia could lose maybe its last trump card of a language that it still has in the region. So this is basically it. I like the paper and everything. I think it has everything a policy paper should have. So if you're interested, I can send some smaller comments in a private message after the conference. So I will now move to the impact of COVID-19 pandemic on EU and Central Asia cooperation by Anna Maria, where she focuses her analysis on shift in EU approach towards cooperation and challenges posed to this new approach by the pandemic. I think you rightfully highlight how this multiple year planning allowed EU to act fast and allocate some resources for rapid response to Central Asian kind of urgent needs during the pandemic. I think you draw some of your current paper on your previous paper, when which is drawing lessons on past cooperation between EU and Central Asia. So I really like this continuation of what you're doing. So I think this is a very thorough analysis of what you did in this exact paper, and it's an excellent job summarizing and explaining the specifics of the revised EU approach to Central Asian cooperation. And I think the word resilience and the agency pop up way too often when we look through the EU document itself. And one way to put it, we reconsidered and we now want to help the Central Asian countries to emerge as stronger, resilient states. Another way to put it, we're really tired of pushing for democratization and human rights and stuff like that. And we will take a step back and respond to the country's needs more, which is also a good thing, I think, if we take on that. The COVID pandemic revealed in many ways how our systems do not work in the region, or how they don't work properly. And EU is, yes, you're right that pandemic affected even strong healthcare systems around the globe, but they were quite fast to be on track, which we didn't see in Central Asia. And EU is a good showcase of good practice, what Central Asia can learn from EU and adapt. So you provide a very nice overview of the sectors affected by the pandemic in the region, starting from healthcare and education and going to kind of related issues of domestic and gender violence and child labor and migrants, and of course, poor infrastructure and communications. So you really provided a nice overview of what was collapsing in the region and how EU tried to kind of support Central Asian states. What was missing, I think, that other players, and these are states, I think, like China or Russia, they work better with media. What they do is better represented in the country, because whenever you hear how much EU, for instance, spent during the pandemic in Central Asia, it comes to many as a shock, because you don't basically see it, right? I mean, you don't see it in the media. However, when it comes to China or Russia, you see it everywhere. And as Kasiet mentioned, media has a real play in that, because over 60 population watches TV and sees what Russia propaganda does, and younger population reads internet kind of outlets and see what China does. So you also, okay, so I like to point that the states could do a better job explaining preventive and lockdown measures in Central Asia, which they basically failed to do. And I think the next thing is very illustrative, as you point that despite the external powers themselves not being heavily involved in local evolutions of the pandemic, their narrative influenced the domestic policies through policy and governmental attitude emulation, as well as through the structure and type of emergency assistance provided. And I think Russia is very nice illustrative point here. So you kind of might add this as an example. And to the previous one, Tajikistan and Turkmenistan are very illustrative, because this kind of a denial really shows how how much harm those mixed messages can do to public health. So there are some interesting points you make, that such as heightened distrust among the states, which led to some competition for vital resources at the onset of the pandemic. So maybe I need a bit more clarification here. So either you talk about the EU or you talk about Central Asia, because what we saw is a bit more opposite, like when they were actually expressing this good neighborly behavior, as Shairbek mentioned. So this maybe that where I need a bit more on that. So as they demonstrated this trend of support through the aid diplomacy, both mentioned by Niva and Shairbek. So, and getting back to the EU, as you said that in the very beginning of your paper, that EU was more focused on its actual needs, like getting the stranded EU citizens back and providing support to their nationals, which to me sounded very much like what we hear before each flight, like put your oxygen mask on you first and then assist others. And I think this is actually a nice strategy to do it, because while you first need to do it at your own home, and then you can take these good practices and lessons learned to Central Asia in this case. So your paper seems quite positive on what EU seemed to achieve during the pandemic, working with Central Asian state. And so now that you look, take a step back and look on what was going on during the pandemic, it's still on, but still, do you think that there is anything that EU could do better or could do differently? So, because what I see is, as you put it forward, the approach was very well structured, very well thought, and very well executed. So are there any drawbacks that you saw, anything that they could improve? So this is it for Anna Maria's paper. I really liked reading it, and I think among all three, this is a very well finished product. So I took the liberty of putting Shairbek's paper the last, but not the least, just because it offers an excellent reflection and resume, not only for this panel. I think Shairbek did a very nice job reflecting on what was going on globally and in the region. I like this zooming in and zooming out approach that Shairbek took. So looking at what how global events then affected what was going on in Central Asia, and also this health allegories of how predetermined health conditions helped either fight back or had a worse effect of COVID in Central Asia. So he poses three questions, specifically international relations, which I think were more on regional scale than on international relations, because we looked more on how Central Asian relations evolved during the pandemic from the very beginning and to this point, how it first stopped and then resumed, and how Central Asian leaders were trying to be supportive of each other. Also, you mentioned that it sped up some of the developments, but I'm not sure if it really brought anything new to the region. You say that there is at least a significant symbolic change, making the region less of 5 fellow post-Soviets and more the rich and the poor. But I think, but the very long period now, it's rather 4, not 5, because Turkmenistan kind of a distant relative that just looks at what's going on. However, during this pandemic, Turkmenistan even sent out aid to Uzbekistan, Afghanistan, and Russia. building up on its image. But I think it's not about the regional cooperation, but it's more of this personified image of Berdimuhamedov. I mean, it has nothing to do with regional cooperation. And yes, political context defines pretty much everything. And I like that you point how Central Asian relations depend on that, like on single persons. Like during Karimov's era, we couldn't really speak about any cooperation, and then Mirziyoyev emerges, and suddenly we see all the revival and the change in political climate. So I also think that it's interesting how introverted and interconnected we found ourselves during this pandemic, and how suddenly we like find ourselves 24-hour observers what's going on everywhere in the world, like starting from US, Belarus, Kyrgyzstan, Moldova, and like we really seem present. But you in your paper say that also we have all these online platforms. We still feel disconnected, and this kind of conferences are one way of bringing people together. But even though states are not communicating that much, I think people-to-people interaction is very, very lively. And there are several examples on that where people formed use these platforms like to psychological help, this art events and everything. I mean, the region maybe was never so connected than before. So there is like two maybe questions to you. Do you think Central Asian states, states came out stronger, punitive states or sort of service provider states? Because what I see now is like authoritarian leaders come out more authoritarian in Central Asia. This is basically it. It's really difficult to comment on what Shairbek did, because I think it really is a nice overview and reflection of what was going on during the pandemic and still goes on. So many thanks to all the speakers for sharing your views and being with us today.
Thank you
for further discussion.
Great. A very responsible job that you did as a discussant, Svetlana. I feel one doesn't want to hurry the discussant when such a thorough discussion is being offered to each paper, which is great. And I think each paper will be, each author will be taking some interesting clues from the comments. And thank you very much to all the presenters, and thank you to discussant, and thank you to all the audience who asked questions or carefully listened. And to Kasiet, of course, thank you for the presentation at the beginning. So this is the end of the conference. Thank you very much, everybody, and stay well. And now we have learned through Zoom that it doesn't have to wait until another year for people to start talking to each other.